Hello everyone, I'm Kolomba. Welcome to They Do Health. Today we have the privilege to receive Dr. TIALA Mulbah from the Healthcare Federation of Liberia. And I know we're going to discover a lot about the Federation today, so please, let's get started. Welcome, Doctor.
Thank you, and thank you for having me.
We're very pleased to have you today.
It's my pleasure.
And today we're just going to talk about the Federation, the Healthcare Federation in Liberia.
Okay.
So we have a lot to discover with you.
Definitely.
And the first question we want to ask you is, please tell us about the healthcare system in Liberia.
Okay, so the healthcare system in Liberia, like many other countries, we have the public healthcare system and the private healthcare. And particularly with the Federation of Liberia, we have our focus in the private healthcare system of Liberia, trying to see how we can improve the quality of care, because as we know, the Ministry of Health largely focuses on the public aspect of healthcare. And so for us, at the Federation, our focus is working along with the private health sector to improve the quality of care.
Okay, how long have you been working there?
So with the Federation, I started working there in 2023. I started as a technical officer,
okay.
And currently I'm the program manager of the Federation of Liberia.
Okay, it's just 1 year ago?
Yes, just a year ago.
Okay.
But as far as the health system of Liberia, I've been working in the health system since 2009.
Okay.
So I have a very good idea of the health system, the different levels, how it works, the different structures. It's just that now I find myself working in the private health sector, whereas I've come from the public health sector.
Beautiful.
Yeah.
Wow. Can you tell us an approximative numbers of institutions we can have in Liberia?
So in terms of health facility as a whole, the country has about 900 plus health facilities. This includes both public and private. Of that number, about 39.9% of them are private health facilities. So you can already picture why it is important to invest into the private health sector, because even if the 60% of public facilities were to improve quality of care at 100%, you still have just 60% of them, and you need the 40% to ensure that the indicators in the country is where we want it to be.
Okay, can you tell us more about your position? What do you exactly do with them?
So with the Healthcare Federation of Liberia, as the program manager, I'm the team lead of the secretariat. So our structure, it's in the form of, we have a board of directors, and then we have the health secretariat, for which I'm the program manager, the team lead. So in my capacity as the program manager, it is my role, along with my team members, to steer the affairs of the Federation. So in terms of the activities, in terms of implementing deliverables, in terms of working along with the Ministry of Health, in terms of improving public-private partnership, it is our role, it's my role as the team lead to ensure that we work together with the Ministry of Health to improve the private health sector.
I know you've been working just a year, but can you at least tell us a little bit of challenges you've met since?
So when it comes to challenge, you know that private health facilities, they have their own issues. Anywhere from accreditation standards, quality standards, to today they are opened, tomorrow they are closed because of logistical issues, because of supply chain issues, because of finance issues. So in our advocacy and role, linking them to opportunities in the Ministry of Health, we are challenged sometimes with, you know, when you're advocating on behalf of a group of people or an entity, today they're available, the next day they have to close and shut down. It becomes challenging because the aspect or the issue of sustainability is not guaranteed. But that's why our role is particularly important, because part of what we do is to ensure health financing for these private health facilities so that they are able to sustain themselves and remain open to serve the people of Liberia.
Beautiful. Can you just tell us what are the most pressing healthcare needs in Liberia currently?
If you ask me, I would say supply chain. The issue of private health facilities getting drugs, maintaining the drugs annually all year round. It's a challenge. We're still trying to work with the Ministry of Health to see how we can all sit on the drawing board and see where they're able to meet us halfway in terms of supply chain, in terms of ensuring that the quality of drugs that the facilities get are of good standards and recommended standards by regulatory bodies in the country.
All right. I think innovation will be very needed in your case. So what do you think about innovation into this area?
Healthcare innovation. Particularly now, since we hit the ground, we've been collaborating with the digital companies, digital aspects, to see how we can digitalize some of the data within our private health facilities. Most of our facilities now are still using paper-based. And so for us, even though it might seem small, we are looking into one health facility at a time, seeing if we're able to take the data that they are collecting from patients, take them from paper-based to using a digital system. So currently, that's the only innovation we will gradually try to implement within the facilities. And then depending on how that goes, we can see if we can scale up to other innovations within the health sector.
All right. Does the federation cover up the whole country?
So no, we are in 6 counties. Liberia has 15 counties, and we are currently implementing just in 6 of those 15 counties. So we are not there yet, but it's particular to note that we don't have private health facilities in all of our counties, and because we are focused in private health facilities, we are primarily working within those counties that have the huge number of private health facilities.
Okay, can you please tell us about the project or initiatives that the Federation has launched to improve health services in Liberia?
So we have implementing partners. We get awards and projects from FHM Engage. We've received projects also from NPI Expand, but our big or major project donor is the USAID, FHM Engage, who we serve as implementing partners for. So, for example, last year we worked on the COVID-19 project with them, where we were charged with the responsibility of working within private health facilities to ensure that they indeed had the COVID vaccines available for the private facilities that are doing immunization, and not just available, but readily available and available when it's needed to be used. Part of our role in working with them is also to ensure that urban immunization was a strategy that we looked into, and we worked closely with the EPI unit of the Ministry of Health to ensure that we are able to develop a roadmap that will improve urban immunization strategy in the country. We also have had several coordination meetings trying to link the public sector with the private sector, trying to include private health facilities into public health facilities discussions, link them with the county health teams. So we have been doing pretty much a lot in terms of improving the quality of care within private health facilities.
So what can you tell Liberian people about the Federation?
The Healthcare Federation, the message I want to send out there is that the Healthcare Federation is a unifying body of private health facilities in the country. Currently, we are working within 6 counties, as I said, 6 out of 15 counties. I would like to encourage private health businesses to join the federation, and they say the more the merrier, so that our voices can be heard and the quality that we seek to get within the private health facility, we can advocate together with the ministry to have inclusiveness in the health sector.
Thanks a lot, Dr. Mulbah.
Yes,
We're happy to receive you today.
Thank you for having me.
And I know you've also learned a lot. Thank you for being with us. I'll just say bye-bye and see you soon.